Mr. Speaker, all appeals for exceptional MediSave use beyond established withdrawal limits are reviewed on a case-by-case basis to consider each individual's unique circumstances. When assessing such appeals, we consider the patient's ability to afford their medical expenses, their available MediSave balances, as well as the individual's eligibility for other financing options such as MediFund.
I thank the Minister of State for her response. Several of my residents have shared that the current limit of $300 is too low for their healthcare needs. I have 3 supplementary questions. The first is to ask the Minister of State whether patients and families are adequately informed of the option to apply for exemptions from MediSave withdrawal limits, and what avenues exist for assistance in submitting these applications. My second question, how long on average does it take for individual applications that exceed MediSave withdrawal limits to be processed, and whether interim relief is available for patients with urgent medical needs? And my last question, whether there are sufficient safeguards to ensure that lower income patients are not discouraged from applying for MediSave limit exemptions due to the administrative burden or complexity. Thank you.
So, Speaker, I thank member for the questions, and I can appreciate concerns from her residents. But I would like to highlight that in respect of her first point, actually within the public healthcare institutions, there are medical social workers who are embedded in the system and are ready and available to actually give guidance to the patients when they do face difficulties in paying their bills. And I would also like to highlight that beyond just the usage of MediSave, the withdrawal, having exceptional circumstances where they can withdraw within the limits, there are also other sources of support, including access to MediFund, discretionary support in the hospitals, in the public healthcare institutions. So that is a key point to note, that I would encourage the patients to go and seek support from the medical social worker, because they may be able to then look at the slew of support that's available for the patients. On the second question, I would like to stress that actually in our healthcare institutions, the priority is given to providing treatment as necessary. So no patient would be in a situation where they would not be able to get the treatment they need if it's medically indicated because of their financial circumstances. That would be prioritized, and that would be something that the healthcare workers and the doctors, the nurses will ensure happens. In the other part of the question, you ask about the timing needed. It really depends on the cases, because we do need to look at each case and the nuances and the reasons behind the application, and the complexity of the case may matter in terms of the timing as to how we actually come up with the outcomes. But I would just want to stress that in no situation has there been where they can't afford the treatment and they don't get the treatment, because that is usually prioritized. The last bit, you ask about how do we ensure that families from low-income families are not prevented or discouraged from applying for exceptional withdrawal limits. I would say that no one is prevented or discouraged from applying for the exceptional limits. Each application will be looked at on its own merits to account for, among other things, their ability to afford it, how much the MediSave balances are, and whether there are other support that is available. For example, like I said earlier, MediFund. So they shouldn't hesitate to ask for help if they need to. On a broader point, I just want to highlight that the first point is that, as I mentioned earlier, MediSave is just one of the options for those who need support. There are other financial avenues available, and I hope that patients are aware of that and would seek help from the medical social workers for that. The second point is that it's always tricky about the MediSave because the intention, the whole objective of MediSave is really to ensure that you have enough for the big catastrophic events that happens. And this typically happens later part in life. So we need to find that balance of making sure that there is accessibility to its usage, but to also preserve it for healthcare needs in the future. To that point, we do review it periodically to make sure that there are sufficient enhancements and support given. As you know, recently we made the announcements about the extension of usage of MediSave for outpatient treatments as well as for outpatient scans. And so this, flexing MediSave and outpatient scans, so these are things that actually reflect that we do review this periodically and will enhance it where appropriate.
Just a follow-up question to the SMS with regard to the MediSave limits. I think some years ago it was suggested by myself whether, I'll try and speak up, whether the MediSave criteria for certain individuals could be loosened on the basis of how much they have in their MediSave accounts, particularly for seniors who I'm sure a member would appreciate, would visit at Meet the People sessions and say, look, we've got $40,000, $50,000 in our MediSave accounts, and we just need a little bit more assistance, particularly since these seniors have retired. And I'm wondering whether the ministry is prepared to exercise some flexibility in a more purposive way to ensure that some of these seniors can be allowed to use more of their MediSave monies. Thank you.
Thank you for the question from the Leader of the Opposition. I appreciate the sentiments because I also do get those appeals from time to time. I would suggest that you can surface it to the ministry. In fact, we do take a case-by-case approach to the situation, depending on the age, and there have been also compassionate considerations, especially if the person is approaching end of life. There have been circumstances where there have been a bit more discretion exercised and leniency given, but we really have to look at the circumstances, the treatment itself, the cost, as well as the balances in the MediSave.
Thank you, MOS. I thank MOS, and I also recognize that last September, MOH actually mentioned that to a parliamentary question that you're looking to review these limits. Many Singaporeans, including my residents of Ayer Rajah, have told me that they don't qualify for the subsidies because they're retired and they're seniors, but they're also unable to fork out the top-up to pay for their medical fees in cash, because that will affect their daily living. And in the rising cost of living, it's difficult for them. I'm asking MOS whether we have a timeline as to when the next review might be.
We do the review periodically, as and when we are looking into it, and when we have reviewed something, we will make the announcements. Recently, as you highlighted, we announced the Flexi MediSave increase from $300 to $400, and we also increased the amount that you can tap on for outpatient scans, because we know those are big-ticket items, from 300 to 600 items. So we will continue to review this. Members who wish to give feedback can also let us know. But as I said earlier, it is really about the balance. There is a need for us to make sure that there's sufficiency for a long run. And there is also something that we need to understand, that there are many different levers, or many different avenues of support. There is CHARS, there is the MediFund in situations where they need so, and we may need to look at what are the different ways in which we can help support the particular individual. But I am open to see if there are any further areas for which members feel that there is a need of this. We do this review fairly regularly.